Looking to reassure people in Indonesia, the government live-streamed President Joko Widodo getting the country's first Chinese Sinovac COVID-19 vaccine last week, the first nation outside of China to grant emergency use. Some neighboring countries in Southeast Asia will do the same over the coming weeks and months. Thailand, Malaysia, Singapore, and the Philippines have all placed orders. This despite a wide range of data on its efficacy from the early trials of the vaccine. From 91% in Turkey to 50.4% in Brazil, just barely above the World Health Organization's cutoff at 50%. Some Southeast Asia countries are reviewing orders and have not yet approved the jab. This has led to some questions about the vaccine, stemming from the lack of transparency and data from the Chinese firm and reluctance to give information to regulators in the US, Europe, and the WHO.
The Chinese regulators do not want to give up the control. So if they would submit their vaccine dossier to one of these, the FDA in the United States, the EMA in Europe, or the WHO pre-qualification process, they would give up a certain amount of control.
He went on to say that even with the lower numbers, the vaccine will still help stem infection rates. And the Sinovac inoculation might be better suited to some nations in Southeast Asia that don't have the infrastructure to keep more advanced vaccines supercooled. Sinovac is based on an older vaccine technique using killed virus particles to build people's immunity. While the Pfizer-BioNTech and Moderna vaccines are more effective, they use a newer method utilizing part of the coronavirus's genetic code to train the immune system to attack. Thailand is looking to start vaccinating high-priority people with the Sinovac jab next month. In light of the efficacy numbers, Thai officials have requested more information but are moving forward with their vaccine rollout. Some here feel as though the lack of transparency around the vaccine is not limited to trial data.
Thai strategy so far is banking on Sinovac and a bit untransparent, a bit of conflict of interest where you have a major Thai conglomerate, the CP group, taking a stake in a company that produces Sinovac. And this raises a lot of questions for Thai society and Thai public health.
Like some of its neighbors, Thailand is ordering vaccines from other companies as well. The Oxford AstraZeneca vaccine should arrive by May. It will then be produced here for local and regional export later in the year. Scott Heidler, Al Jazeera, Bangkok.
Let's get more on this. We're going to talk to Ali Fatom. He's a vaccinologist and vice president of vaccine research and development at Blue Willow Biologics. He joins us from Ann Arbor, Michigan, in the United States. Ali Fatom, welcome to the NewsHour. What's the issue? What's causing the issue here with the efficacy of the Chinese vaccine?
Yeah, thank you for the invite. These vaccines, as you know, it's a full virus, a whole virus that is killed and inactivated. And of course, this is the traditional way of making vaccines. There is a lack of numbers, a lack of information, a flow of information. It's always what we are getting from these trials is really a general statement rather than detailed outcomes for safety and also for efficacy. So as you can see, we are seeing different performances in different countries, and this is really somehow strange. I think that we need to see more information. And it's not like it's a suspicion, but at least to know what is going on in these trials, because those numbers between 50 and 90%, it makes us wonder, exactly how these studies were run, what is the population that was tested in, and also what is the efficacy across the board, with the different ages. So those are the kind of information that with Western standards is really did not meet those standards. So therefore we are really looking for that.
Just to be clear, if the success rate is 50.4% in countries in Latin America, that is 0.04% too close to the WHO's reaction, which would be, not wishing to put words into your mouth, what's the point? If the fail rate then tips into being a fail rate instead of being a success rate, why bother? Why not just give somebody another vaccine?
I think we have to look at this objectively. When we say 50%, if you look at the influenza vaccine, the efficacy of the influenza vaccine, which everyone is taking, is about between 30 and 50%. It never really exceeds that in the last 20 years. So basically, the ability to protect at 50%, add to that the fact that there was almost no severe or mild infection in these people. So meaning that you are not preventing the infection totally, but you are really protecting against severe disease and against mortality and against other diseases. So therefore, preventing severe disease is also an advantage, and therefore we cannot just discard the baby with the dirty water. We need to look at this as an achievement, and especially we are talking here about a full virus homogenate or inactivated vaccine that will give a good immunity. So therefore, I don't really discount that. I think it's an advantage, and we should take care of that, especially under the circumstance of an epidemic.
OK, Ali Fatam, when I've got you there, can I get your opinion on a European aspect of the vaccination programme? Several European countries are going down the same road now. They started about 6 or 8 weeks ago. Their starting point was, we will vaccinate the population of this country once, then we'll follow it up with another vaccination 3 weeks later. Various governments are now saying, actually, it might be several months later. Does that mean in the intervening several months, instead of 3 or 4 weeks, people are less protected than they would have been had they had 2 vaccinations separated by 21 days?
That's a very good question. And I think that looking at the data from the one immunization, we've seen that there is about an efficacy of about 80%, around 80% with one immunization. And that probably will continue to be around for months. And therefore, spacing the second injection or second immunization by 2 months or 3 months, it could even have some advantage. So by protocol, we have to give it every 3 weeks interval. But if you look at the practically and immunologically, it could be an advantage even to delay the second dose to 1 month or 2 months or 3 months. So I don't believe that there will be any issue with regards to the efficacy or increasing a risk for the population who will take one and then 2 months or 3 months later get the second immunization. I think this is really a practical and realistic approach to the pandemic and the need, which is huge out there, and that could be a very smart approach.
That's a really interesting point to draw our conversation to a close. Ali Fatam there at Ann Arbor, Michigan. Thank you so much.
Thank you.